Welcome to this presentation of the peak study in NMOSD. For those of you that are new to peak studies or might not have participated in this particular study, a peak study has two components. One is a telephone interview with a registered nurse, and it's a structured interview, so we ask exactly the same questions to each and every participant. The other side of the study is an online questionnaire. That's a series of different validated tools, so tools that have been used in other studies, so we know we can rely on the results really well, and also some information that we collect around people's experience in the health system, what treatments they've experienced, and their experience in navigating the healthcare system. This particular peak study was generously sponsored with a grant from Alexion, and we're really so very grateful for their support. It's been such a joy working with Alexion on this study. They've been incredibly supportive, but also giving us the independence to be able to do the study at arm's length, asking the questions that we need to ask the patient population and keeping the study really independent in that way. Also really want to thank the NMOSD Australia support group on Facebook that have been so great in spreading the word about the study so that we've been able to have a good participation in the study and create such a strong report. So the study itself is presented in a platform like you see on the screen now. There's lots of different domains or different subject areas that we ask about in the study. So depending on what your interest is, you can look at the different sections, whether it's around treatment that you're interested in, communication and information, care and support, quality of life, what people want from the future, or any of these different topics. So you can read it all at once, or you can take it bit by bit and look at the different sections that are easy to navigate on a dashboard that looks just like this. So for those of you that participated, we can't thank you enough for giving your time and for sharing your experience with you. So this is just to let you know how we process all the information that you provided throughout the study. So the qualitative side of the study, that's where you would have done a telephone interview with one of our nurses. So what we do after the interview is that we transcribe your interview word for word. Then we have someone check that transcription to make sure that we've gotten everything that you said and that we've gotten it down perfectly. After that, we take away any of the identifiable information, so any of the names of, if you might have mentioned a doctor's name or a family member name, your name's removed, just so that we can keep it non-identifiable and keep your privacy safe and sound. Then we have two researchers that look at the information that you provided in the interview, and they both do a separate analysis looking at all the different themes that have come through the questions that we've asked. Once they've both done that, they swap over and change to review each other's results to make sure that they've gotten the same answer. We do that so that we know that we've interpreted what you've said correctly. So it's not just one person looking at it, we have two people. After that, then we do another round of quality control, just as another check to make sure that what you've said has been interpreted correctly. For the online questionnaire, we have a similar process where we remove anything that could be identifiable. So taking out any names or anything that could lead somebody reading your report back to you, so you maintain your privacy. We have a researcher that does an analysis of the quantitative data. So they use different formulas to go through the data that we've collected. They then set that aside and they do it again to make sure that we get the same result. We do that to make sure we've not made any mistakes in the reporting of the information that we've collected. So section 1 of the study, this is where you can read around that methodology. So if you're interested in research and want to know the methodology, you can have a look here. This is also a section where we look at where this particular peak study sits in terms of other studies that might have been done around the world. So what we see in this study is that we had 18 people that were diagnosed with NMOSD throughout Australia that participated in the qualitative interview and also in the questionnaire. And when we looked at the other literature that we could find, we found it's the only mixed method study reported in an Australian population. And it's also the most interviews that have ever been done in an NMOSD population worldwide. Section 2, this is where we look at who participated in the study, the demographics. We also look at the baseline health of the people that participated in this study. So we had 18 participants. We also had 10 carers, and we also in this study talked to a number of people with MOG. So I'm not talking about the MOG participants today, but they are reported in the study as well for those who were MOG participants. Most of the participants in this study came from the east coast of Australia, which is of course where most people in Australia live. There was a mix of education levels from people that had gone through university and others trade or high school level education. There were most of the people came from metropolitan areas compared to regional areas, and most of the people were women. The average time that people spent talking to one of our nurses in the telephone interview was 56 minutes. So people had a lot to talk about in their structured interview. Throughout the study, you'll see subgroups. So when we report the results in the study, you'll always see the result for the whole population, as well as the result for subgroups. So if you're ever wondering, wonder what life was like for different age groups or education levels, you'll always see the different results. When we look at the whole study, where there were most variations in those subgroups was the slightly younger population within the study, those from a mid to low socioeconomic area, those with low to moderate fear, low to moderate anxiety around their condition, and those that had had more relapses. The SF36 is a questionnaire that we use, and it's in the online questionnaire. And what it tells us is the baseline health for this patient population that participated in the study. So what we've seen is overall participants reported quite poor overall health, and some of those areas included physical health, which interfered quite a lot with people's ability to work or conduct other activities. Likewise, emotional problems interfered with the way people were able to work or go about their other activities in life. People had quite poor energy, a lot of fatigue, and on average, the participants reported having health that is somewhat worse now to 1 year ago. In section 3, this is where we look at symptoms and diagnosis, and you can find information about the experience of symptoms before diagnosis and really what led to the diagnosis itself. So these slides come here from the online questionnaire, where we asked the participants to note down any symptom that they had before diagnosis. So the most common ones were eye pain and loss of clear vision, things like muscle spasms and sensory loss as well. The next question that we're presenting here comes from the structured interview, so the telephone interview. And this isn't a question about every symptom that the participants had. It's more about what actually led you to a diagnosis. So the most common symptom that led to a diagnosis were visual problems. We noted a lot of people, or just over a quarter of the participants noted that they were first misdiagnosed with MS or another condition. So that tells us a lot about that diagnostic pathway that hasn't been smooth for this patient population. When we talk about the pathway to diagnosis, what we saw is that ultimately nearly 45% of the participants in this study said that they were diagnosed under urgent medical care. So something had escalated so much that they had to have urgent medical care. There are a number diagnosed through their general practitioner that sent them to a specialist as well. We also had a number of people talking about multiple specialists that they needed to go to before they actually got a diagnosis. This is a question that we ask in the structured interview, the telephone interview, about how much you knew about NMOSD when you were diagnosed. So most of the people in this study said that they had absolutely no understanding or very little understanding when they were diagnosed. Another question that we ask is around prognosis. So what people understand is their outlook. What's their prognosis? So just over a quarter of the people in this study said that their understanding of prognosis was that there were permanent effects from the condition and that they would suffer from it long term. People describe their prognosis also as needing to continue with treatment to prevent progression or deterioration. And there were just over 10% that described prognosis as being aware that there's probably a cycle of recurrence that they will go through over a long period of time. In section 4, this is where we look at decision making. So how people made decisions about treatment and what was the communication like around treatment discussions. So just over 60% of the participants said that at diagnosis, they had discussions about multiple treatment options. And this might have also included things like allied health professionals, physiotherapy, occupational therapy, not just medications. When we drill down into what those conversations were like, where multiple options were presented, there was a feeling from the participants that they were told what to do without much discussion. So while options might have been presented, there wasn't much discussion in that decision-making process. Just over 20% of the people did feel that there was some discussion. They were able to participate in the discussion. So it varied a little bit between the participants, how they felt those initial discussions about treatment were held. Some of the specific treatments discussed ranged as well, with lots of people being told about rituximab, steroids, and plasma exchange were the main things that they could remember being discussed at that point of diagnosis. So what do people think about when they're offered a treatment? What are some of the things that they're contemplating? So this was a question, what do you consider when you're thinking about treatment options? Just over a quarter of the people were thinking about side effects. Some people were talking about efficacy, just over 20% of the participants in this study, so how well a treatment works. Cost was another important consideration. There are also just over 15% of the patient population that really took the advice of their clinician as the main source of their decision making. This is a question we ask around, does decision making change over time? So most of the population in this study, close to 90%, said that, yeah, they felt like decision making changed over time as they progressed through their condition from diagnosis. Some of the reasons for that was that they became more informed or they became more assertive. Other reasons were more awareness of their health and their own responsibilities and limitations in their health as well. This is a question we ask around, what are the personal goals of treatment or care? So most of the participants in this study said that they wanted to maintain their condition and prevent worsening or prevent relapse. Just over 15% said that they wanted physical improvements to be able to live independently. There are also a number that hadn't really considered their personal goals in treatment. Section 5 is all about treatment, so it's quite a large section in the study. So for those interested in treatments and what has been offered to patients and how they've managed their treatment, this section has a lot of information for you. So the first question that we're reporting here is whether people felt like they'd been treated with respect within the health system. So most people had found that they were treated with respect, with maybe one or two occasions where they didn't quite feel that they were treated respectfully. This is a slide that shows whether people have had to have reductions in their income, changes in their work. And we've got a nearly 50-50 split between people that had and had not had to change their income or their work situation. But where people had, what we can see is there was a somewhat moderately or extremely significant burden from that change in income. So this is an overview slide of the types of treatment that the participants in this study reported having. I'm not going to go too much into the different treatments. And as I said, this is a really large part of the study. So for those interested, you can go back into the report and have a look at the different treatments that people experienced, also their quality of life and how effective they felt the treatments were. So I've just put this slide up to give you a little bit of a sense. And if you want more information, this is definitely section 5 where you can go back for more information. In terms of allied health, so what kind of allied health professionals people have accessed, the most common ones were things like occupational therapy, psychology as well, and physiotherapy came in as a reasonably common allied health, but we probably would have expected more people to be able to access physio and occupational therapy. Lifestyle changes, so a lot of people spoke around taking up more exercise, reducing alcohol, and diet changes was another reasonably common way that people changed their lifestyle once they were diagnosed with NMOSD. Complementary therapy, so the main thing that people with NMOSD accessed for complementary therapies was using mindfulness and relaxation. Others were using supplements as well. Those are the most common things in complementary therapies. In the study, we asked a couple of questions around access to clinical trials. So the first one is whether anyone's had a discussion to participants around clinical trials, and most of this patient population hadn't had the opportunity to discuss a clinical trial with their clinician, and nobody had participated in a clinical trial, but most people, if there was one in the future, would be really interested to do so. In the telephone interview, we asked participants to describe what's a mild side effect here and what's a severe side effect. So in terms of a mild side effect, most people describe this in context of a specific side effect that they had experienced. Where they provided a description or a definition, it was mostly things that could be self-managed or didn't interfere in everyday life. So some of those examples of mild side effects that were given were things like numbness. Neuropathic pain was also something that people experienced that they thought was quite mild. Fatigue and tiredness came up with just over 10% of the patient population, as did gastro distress. In terms of severe side effects, again, most people describe this in terms of something that they'd experienced themselves. And where a description was given, it was around things that impacted everyday life or meant that people couldn't continue the way they lived life every day. Some of the examples of severe side effects that were given were pain and also vision loss. One of the questions we ask in the telephone interview is also around how well people think they adhere to treatment, so how long they stick with the treatment before they might give up. So just over 25% of this patient population said that they would stick to treatments as long as side effects were tolerable. Just over 20% said they hadn't given up on any treatment. And just over 15% said that they really stuck to things as prescribed by their specialist. We asked a really important question to the participants about what really needs to change for you to feel like treatment is effective. So the most common response, just over 30% of the participants said they really needed to see a reduction in their symptoms. The next most common response was being able to see an improvement in pain levels, which makes sense when we've just seen the slide about the most severe side effects being that pain, that level of pain. Over 20% of the participants said they really wanted to prevent relapse or worsening of their disease. And they also wanted to improve mobility. We asked participants about preference for treatment at home or in hospital, and most of the participants, 50%, said that they preferred their treatment to be at home. Some of the rationale for the people that prefer treatment at home is because it's more convenient, more comfortable, less interruption to daily life. At the moment, when we're going through a pandemic, a lot of people were quite concerned around infection in hospitals, but also being immunocompromised. That's going to be an ongoing concern for a lot of people with NMOSD being in home or at hospital. For those that preferred to be in hospital for treatment, they preferred that in case something went wrong, they would have the experts on hand to help them deal with it. The next question that we asked is, what would it mean if treatment worked? So what would it mean to you if treatment worked? There are over 30% of the patients in this study that said if treatment works, it allows them to engage more with their family and with their friends in their social life. Just over 20% said it would allow them to return to a more normal life, return to activities that they want to do every day. 15%, just over 15% said that it would give them increased independence and mobility. And just over 10% were excited that if treatment works, it means they can return to school or work. In section 6, this is a section around communication and information. It's where we find out how patients in the study accessed information and what was helpful and what was not so helpful, and a little bit about health professional communication in the health system. This is a slide that shows us what information was given to participants, but then also what they had to then go and search for themselves. So it tells us a little bit about what's important to the participants in terms of information that they really want to find. So if we look, for example, where information was given and then it had to be searched for as well, we look at treatment options was something that people really needed to look more into: physical activity, social support, and also the cause of disease. So this is a really important slide for those interested in what kind of information is important to this patient population, what they've needed to search for, and also what they're not searching for as well. So we can see that some of the information that wasn't searched for is things around clinical trials. This is from the online questionnaire, so it's the Partners in Health tool. So it's a questionnaire that tells us how much knowledge the patient population in the study had about their condition. So overall, on average, participants in this study had quite an excellent overall knowledge of their condition, and they had a lot of confidence in managing their own health. So when we think back to that earlier slide where at diagnosis patients really didn't know anything about the condition, they've done incredibly well to find information and find the information that they need about NMOSD to be able to manage their condition. Some of the information that people have accessed has been on the internet, including health charities, Facebook, overseas foundations as well, people looking at journal articles, the medical literature, their clinician, and also other people's experience. The information that has been helpful has been other people's experience, talking to a doctor or specialist, and also information that's really condition specific. What's not been helpful? Well, most people felt that there wasn't really any information that hadn't been helpful, and they felt quite confident in deciding themselves whether something was helpful or not. So nothing much in there that they didn't find helpful. In terms of information preferences, the people in the study were asked if they had a preference for online information, talking to someone, an app, or written information. So the most common combination was that online information or talking to someone as well. This is important for us all to remember when we're thinking about how we present information to people, that there's always going to be a bit of a mix of preferences. So online's really good, but it's also really important that there's somebody that people can talk to as well. There's some rationales for all those different preferences. So for online information, being able to digest the information themselves, where it was more about being able to talk to someone, it's being able to have somebody on hand that they can discuss information with, and also to be able to share their experience with is important to this patient population. Timing of information. So this is a question about when people felt they were ready to absorb the information that they were reading. So not just when they were giving it, but when they were really receptive to taking that information in. So over 35% of the people in this study said that they were ready to absorb information from the very beginning, but an equal amount were also needed a little bit of time to digest. So again, that's really important, particularly for health professionals, to remember that some people need a little bit of time before they can really take anything in. So while we might give information at the very start at diagnosis, it might not always sink in straight away. Health professional communication. So this is a question we ask participants how they felt the communication with health professionals in their experience had been. So for this patient population, overall, they'd had a somewhat negative experience of health professional communication. There's over 60% of people that felt it had been a negative experience. Some of the reasons for that, so where it had been poor, is that they felt the health professionals had a really limited understanding of NMOSD. And others where it had been poor had been because it had been dismissive or a one-way conversation. Where it had been good, it was because there was a holistic two-way conversation, so a real discussion and real communication. Section 7, this is around care and support, so where people have found care and support throughout their experience with NMOSD. So this is the report from the online questionnaire, and it's a care coordination tool. So it measures how well people have been able to navigate the health system. For this patient population in this study, there was an average score that indicated that the participants had quite a moderate, so just somewhere in the middle level of health system navigation. So what that tells us is that there's room to help people navigate the health system. It wasn't great and it wasn't horrible, somewhere in the middle, a lot of room for improvement to support this patient population. So where has care and support been received? So this is a question where we ask people where they had either been offered help or they had gone to find help for care and support. So the main response was that people really hadn't received support from anyone in particular. Where support had been received, it was in the form of domestic services. Just over 15% of the people said it was in terms of transport to and from appointments, and some support being given from the hospital or clinical setting. Section 8 is around quality of life. So this is another quite big section in the study. It's where we look at the quality of life of the participants and their families, impact on relationships, any cost burden that they might have incurred throughout their experience as well. So the fear of progression tool, it's a tool that measures the level of anxiety that people have about their condition. And overall, what we've seen in this particular cohort is that the people in this study had really quite high level of anxiety around their condition, around the progression of the disease. And actually, in all the studies that we've done, this was the highest level of amongst the highest level of anxiety that we've seen across at least 20 other conditions that we've done similar studies in. So this is how we represent that. So you can see a number of other conditions that we've looked at, and on the right is the score for NMOSD, which is that much higher than any of the other conditions that we've looked at. When we look at some of the questions within that fear of progression, we just drilled down a little bit to see what are some of the main things that might be driving that anxiety that people have around their condition. Some of them are around not being able to reach personal or professional goals, so goal setting for the future, worried that they won't be able to continue in everyday hobbies, everyday life, worried that treatment could damage their body. They worry what will happen to their family if something happened to them, and also not being able to work due to their condition was another concern. Impact on quality of life. So this is from the telephone interview. We asked the participants, what has the impact on quality of life been? And here we see quite a strong response that most participants felt that overall it had been quite a negative impact on their quality of life. Some of those negative impacts were the emotional strain on their family and the change in relationships within their family. There was a negative impact in terms of physical activity, and social interaction was another thing that came through. Likewise, we asked the participants in the interview, has the diagnosis of NMOSD had an impact on mental health? And over 80% said yes, in some way, shape or form, there's been an impact on my mental health. This is a question that we ask participants about, what do you need to do every day to maintain your mental health? So a lot of people took up physical exercise, mindfulness and meditation, which we saw earlier in the complementary therapies that people took up. Consulting a mental health professional was another common thing that people did. And using coping strategies, so things like social interaction and lifestyle changes, and taking up hobbies just to help with their mental health. In terms of what people did every day for their general health, some of the things were also staying physically active, but also understanding their limitations and knowing when they needed to stop, know their limitations and when to say no to things, and also self-care, so making sure they had time for rest when they needed to, getting support for housework when they needed to, and things like that. We asked participants if they felt the diagnosis of NMOSD had an impact on relationships. And over 60% said yes, they felt like there was some impact, a negative impact on relationships. Fewer people said that there was no impact, just over 10%. And the same number actually said there was a positive impact on relationships. So some of those reasons for relationships suffering was that there was they had less opportunity, less capacity for socializing. Where people felt there was a positive impact, it was because they felt that relationships had been strengthened since the diagnosis of NMOSD. People chipping in, people being really supportive. We asked participants about whether they felt there was a burden on their family due to the diagnosis of NMOSD. Over half of the participants felt that yes, there was a burden on family. Just over 10% didn't really feel like that there was a burden. Some of the reasons for that was that they needed to do extra household duties that their family had to take up, needed more assistance getting to appointments as well. Cost considerations, so there was the majority of people in the study felt that there was at least some cost burden due to the NMOSD diagnosis. Some of that related to time off work for themselves, some of it related to time off work for a family member. And we've seen that through the study in different sections as well, that impact of reduction of income or needing to reduce work hours. There was a cost burden from treatments as well that 50% of the participants noted. So section 9 is where we go into what people want from the future, what the participants in this study want from future treatment, care, information and communication. In terms of future treatment, so in this question we asked people what would they like to see in the future from treatments. So fewer or less intense side effects was the main thing people wanted to see in the future, and also having more availability, more options for treatments. Future information, the main thing that came through here was more information that is really disease specific, really specific about NMOSD, not bundled up in other disease areas, something that's just for the NMOSD population. I'd also like to know a little bit more about what services are available, what support services might be out there for people with NMOSD. In terms of future communication, the main thing that they want from healthcare professionals is communication that's more transparent, so more comprehensive, and also more forthcoming. That was the main theme. Some other themes that came through was wanting more time with the clinician, more time to be able to talk about the questions that they had, and also more time to listen to the concerns that patients have about their condition, the different symptoms that they might be experiencing, and what they might be worried about as their disease may progress or if they have recurrence. Expectations of future care and support. Well, what this patient population would like to see is access to specialist clinics or services, so people that really understand NMOSD. They'd like more condition-specific support as well. They'd like to see more peer support, so of that, understand what other people are going through, being able to support each other. And then just in general, access. So again, knowing where to go for services and support. What people are grateful for in terms of the Australian health system is the low cost or free medical care that we get through the Medicare system. They're grateful for the hospitals and the healthcare staff. A lot of people, just over 15%, were grateful for everything. And again, the low cost treatments that are available through Medicare. This is a question that we ask people if they were standing in front of the health minister, what their message about NMOSD would be. What's the most important thing for decision makers to know? So the most common theme here was that people wanted decision makers to know that there's a real need to access new treatments, that we need to invest in research, and we also need to improve access to support and care for people with NMOSD. In section 10, this is where we ask people to reflect on what advice they might give to people in the future. And we ask them to do that using the advantage of hindsight. So the questions we ask here is, what did people wish they knew earlier? So they could go back in time, what did they wish somebody had told them a bit earlier in their disease progression? So the main themes here were that they wanted to know what to expect from their disease. So what's the trajectory of NMOSD? They also wanted to know earlier about the different treatment options available. Just over 20% of the people in this study also said that they wish they'd known earlier what questions to ask so that they could advocate for themselves. For those people that wished they'd known things earlier, we then asked, would this have made a difference to the way that you approach your treatment? And importantly, most of the people said yes, that they would have changed the way that they approach their decision making. In section 11, this is where we have a discussion. So we take all of the results of everything that we've learned through this study and we compare it to the literature that exists in the medical journals. So I'm not going to go through this here, but it's really a great section if you want to understand what's the current state of play in NMOSD, what are the current treatments and how this patient population experienced the health system compared to other people that have been studied in different studies, particularly overseas. In section 12, this is the last section. And in every study we do, we have a look at the results of the study to think about if there were 3 things that we could do better for this patient group, what would they be? So for this patient population, our 3 recommendations are around information, health system navigation, and symptom tracking and monitoring. So throughout the study, the participants noted difficulties in finding local and disease-specific information. So what we know this patient population would benefit from is an Australian website with transparent and forthcoming information about NMOSD. And also information about emerging treatments, clinical trials as they come up is going to be important as well. We've also heard suggestions from the patient population in this study that having either an annual meeting around with local clinicians, talking about the research coming through and the current treatments that would be really helpful for this patient group as well. The second recommendation is that once diagnosed with NMOSD, that people have access to appropriate allied health and supportive care. So what this patient population could benefit from is the development of a health system navigation kit. So knowing where to access help and support so that they can also advocate with their clinicians about what kind of services they want and what kind of services they need. The third recommendation is around symptom tracking and monitoring. So a theme within the study was about the importance of avoiding relapse and maintaining current health and independence. So this patient population would benefit from the development of symptom tracking tools so that they can monitor their ability to function over time and also recognise any changes that they might be seeing within themselves so that they can access timely medical or therapeutic interventions. So that's the end of the study report. What we've presented here today is really just the tip of the iceberg. When you go into the report itself, you see it's quite long. I think it's somewhere over 300 pages long. So you'll probably go back to it time and time again to look at the different subject areas, read into the different areas that you're interested in, and you'll always see the different quotes that patients have given describing their experience. So particularly for patients and families out there, it's also a great education tool to really understand what other people have gone through and what you might expect from the health system as you go through the health system yourself. But now what we have is an exciting progression from this study where we've put together a new website just for the NMOSD community in Australia. So this is nmosdaustralia.org and it's available now for the NMOSD community. So what we've put together is some information sheets around NMOSD from diagnosis and treatment and care and support and other topics of interest. We've got a section on research, so what's the current state of play in NMOSD. We'll be putting together some information on treatment centres, so where we know there's experts working in NMOSD, so that patients know where to go for that specialist help and support that they need. We'll continue the peak register, so for anyone that missed out on participating in this study, they can always have an interview and complete the online questionnaire. So we'll keep collecting information from the patient population to help us learn about NMOSD and learn about the experience of people with the condition in the health system. We're also launching a telehealth nurse support service. So this is part of the Patient Pathways telehealth nurse service. So anyone can book in to have a consultation with the telehealth nurse around, and we've got 3 different sort of areas that we're particularly focusing on for the NMOSD community. So one will be a new diagnosis nurse education session. So when someone's newly diagnosed with NMOSD, can sit down with the nurse and go through what this condition is and what they can expect. So understanding what to expect in the future and really understanding what the biology of the condition is. There'll be a symptom tracking opportunity. So for those with NMOSD, if you'd like to be able to better track your symptoms over time so that then if something changes, you know when to be able to seek advice from your treating clinician. That's another session that people can set up with the nurse. And also appointment preparation. So this might be if you're coming up for an appointment with one of your specialists, sometimes useful just to chat through with a nurse or even somebody else. What are the questions that you want to go in with to ask your treating clinician and what information you should take with you so that you make the most out of that appointment. So this is something that we'll be developing over time. This is a starting point where we've put some information up. We've also had requests from already from a few people that reviewed the website to put information up about what financial support might be available. So any of those kind of recommendations that come through we'll be adding over time. And of course, importantly, this is also a place where you can connect with the existing NMOSD Australia Facebook group, which has such a wonderful community. They're already a community of support and information. So we'll be very much working with the Facebook group to make sure everything's aligned, and that any new recommendations or requests for the website will come through as well. So this is all going to be available now from straight away. You can see the website address there. We'll be putting a link to the study itself on the web page so that you can go back and read all the results. And as I said, it's a really great tool that any patients or families can go in and read and try and understand other people's experience and what they can expect themselves. So that's all for today. If you have any questions or comments, keep them coming in the comment section below. We'll be checking that over time if new questions come up after today's session. And of course, any recommendations for the website or any requests, just pop them through as well. So thanks for joining today. Thanks again to Alexion for the arm's length grant that supported this study. Thank you so much to the NMOSD Australia Facebook group that have been so supportive in spreading the word about this study. And we look forward to working with the NMOSD community into the future.